Hey everyone, my name is Fatma, and in this video, I'll be talking about metaplasia. So, just a general overview first. Metaplasia is one of the growth adaptations that a cell can undergo. These growth adaptations usually arise as a result of increase, decrease, or change in stress in response to physiological or pathological stimuli. These changes allow the cells to better handle the new stress. But if the stress exceeds the cell's ability to adapt, then you can have cellular injury as a result. The definition of metaplasia is a change in stress on an organ that leads to a change in cell type. Most commonly, this involves a change from one type of surface epithelium to another, and this occurs through reprogramming of stem cells, which gives rise to the new cell type. Then this new cell type is basically able to handle the new stress. This whole process is reversible in theory if the driving stressor is removed, but if there is persistent stress, then this can lead to dysplasia, which is disordered cellular growth, and eventually this can progress to cancer. One exception is the apocrine metaplasia of the breast tissue, which does not carry increased risk for cancer. So now I'll just be going through some of the examples that you can mention during your finals. The first very common one that you hear about is Barrett's esophagus. So you have the normal esophageal mucosa lined by non-keratinizing squamous epithelium. But if you have gastric esophageal reflux disease, for example, you have acid reflux into the distal esophagus. This damages the mucosa of the distal esophagus. So you have the metaplasia occurring from non-keratinizing stratified squamous epithelium to non-ciliated mucin-producing columnar epithelium. It's also known as intestinal metaplasia. You can see that in this picture, in this endoscopic picture. So you have the normal tissue, the pink tissue, which is around here, and it's being replaced by this more dark red tissue, which represents the non-ciliated mucin-producing columnar epithelium. The risk factors are GERD, obesity, smoking, family history of Barrett's esophagus, and esophageal adenocarcinoma. Because under persistent stress, this can progress to dysplasia, like I mentioned in the previous slide, and eventually you can have adenocarcinoma of the esophagus. Here I included a histological picture as well. So you see the non-keratinizing squamous epithelium right here, and you can see how it's changing into this this intestinal epithelium, almost like you can see the goblet cells right here and the glandular epithelium, representative of intestinal metaplasia. The second example would be of squamous metaplasia of the respiratory epithelium, and this is associated with smoking. So the respiratory epithelium is being irritated by the chemicals in cigarette smoke. So you have a replacement of the ciliated pseudostratified columnar epithelium, which is around here, to stratified squamous epithelium, which is here. Another example would be vitamin A deficiency. Vitamin A is very important for differentiation of specialized epithelium in the eye. For example, the squamous lining of the conjunctiva undergoes metaplasia into stratified keratinizing squamous epithelium, and you can see beta spots, which are right here, increased keratinization. The squamous lining of the conjunctiva undergoes metaplasia into stratified keratinizing squamous epithelium, and you can see beta spots, which are right here, increased keratinization, the eye. And this change is called keratomalacia as well. I include this example of myositis ossificans just to show you that metaplasia can also occur in connective tissue. And so this disorder is basically characterized by bone formation in soft tissue and or muscle. Usually this is after some trauma or injury, and this occurs during the healing process after the injury. And obviously, because you have bone being formed where there would be soft tissue, you have muscle stiffness and restriction of movement. And in this X-ray, you can see it right here, this pathological bone formation being occurring in the vastus medialis muscle. This example of cervical ectopy is basically an example of physiological metaplasia. The squamous cell epithelium of the ectocervix, which is the normal pink epithelium that you see around here. It's being replaced by columnar cell epithelium of the endocervix, the more reddish tissue. This is usually under the influence of estrogen. This can be during pregnancy, for example, or if you're taking oral contraceptives, even during the hormonal changes around puberty. So this can be common in younger women. This change is seen on colposcopy, and it's usually asymptomatic. There can be some occasional postcoital bleeding and vaginal discharge as well. But yeah, it's mostly asymptomatic. And here are the references that I used. And with that, we come to the end of this video. In